All right, welcome everyone. Thank you for joining us today for the Medical Writing Professional Certificate Information session. My name is Jessica Bradford, and I am a program manager here at UCSD Extended Studies in the Healthcare Education department. And I will be your host this afternoon or this evening, depending on where you're calling in from, as we do an overview of the Medical Writing Certificate Program, and we'll definitely have time for questions. So I'll go through some information, and then after I cover that information, if you have questions, please do ask. You're welcome to chat, put your questions in the chat if you'd like, or you're welcome to unmute yourself and ask a question. And what else did I want to say? Oh, this session is being recorded. And so once we're done this afternoon, this session will be posted on our website. So if you have friends or family who were friends, colleagues, family maybe, who wanted to join and weren't able to, you can let them know that it will be posted on our website. All right. So our plan for this afternoon is to do a program overview of the Medical Writing Certificate Program. We'll talk about the course curriculum, the program costs, and then we'll also talk about the capstone options. One of the greatest benefits to our program, although I may be biased, but is that we have professionals who are currently working in related fields to medical writing who are on our faculty. And you can see a list here of faculty members, and many of these folks are joining us today on this call. I know Donna is here and Jen is here. And I think a few others are planning to join us. So a nice benefit of joining us live is that if you have questions specifically for the faculty who teach in this program, you'll be able to ask them your questions. All right, so for a program overview, talking about what we teach in the Medical Writing Certificate Program, we are teaching a specialization for those with biomedical or life sciences backgrounds. And so in the program, you learn how to write scientific documents that are well structured and presented at the right level for the target audience. You'll gain a baseline knowledge and skills to obtain a position as a specialized medical writer and build the foundational knowledge of the role of medical writers and a variety of specific skill sets. Hold on just one moment. I need to let my dog out. Excuse me. So sorry. He was sound asleep all afternoon, and now that I started talking, he really wants to know what's going on. And he acted like he wanted to leave, but he really doesn't. So excuse the interruption. Who do we teach in this program? Working professionals, many who work in a clinical setting, MDs, NPs, PharmDs, people who are looking maybe to move away from working in a clinical setting and into a medical writing position. We have industry professionals who are moving to new medical writing positions within their field, recent PhDs, postdocs, and we've also seen a rise in international students who have writing experience and they're looking to advance their writing skills. So the way our program works is it is 100% online. And each course is offered, we're on a quarter system. And so when you register for a course throughout the quarter, you'll have access to pre-recorded sessions and also individual or group meetings with the course faculty in live online sessions using Zoom, like this session. You have the opportunity to earn a professional certificate in medical writing in 9 to 12 months. And we have starting points in the fall or spring. And this is why it works. You have the opportunity to gain practical hands-on training with leading medical writing and editing industry practitioners. There are real-world examples provided throughout the courses and in coursework. The online format, which also includes micro content, so shorter videos, articles, this sort of thing, allows flexibility for working professionals. So many, if not most, of the folks who are in this program are working professionals who are doing the certificate to add to their skill set. And then also our program includes critical thinking, decision-making. There is a course in the program that is specifically on ethics for medical writers. So getting into the course curriculum, for people who are brand new to the field, there are recommended prerequisites, and that includes medical terminology, a grammar lab, clinical trials, and a regulatory writing primer, and then also a clinical trials course that is on practical clinical statistics for the non-statistician. These prerequisites are recommended, which means they're not required. So for those of you who might already have experience or expertise in some of these things, for example, people who have a clinical background don't necessarily need medical terminology, for example. So that's why these prerequisites are recommended and not required. It's really up to you to determine what sort of prerequisite information, coursework that you need to get up to speed to be able to join the program. The required courses, there are 10 units of required courses. And they include the Introduction to Medical Writing and Editing, Applied Medical Writing and Editing, and these two make up a series. So the Introduction to Medical Writing is a prerequisite for the Applied Medical Writing. You have to take the intro first, and then you're able to move on to the Applied course. But the other two required courses, the Ethics for Medical Writers and Designing Figures, Tables, and Graphs, they can be taken at any time during the program. And then in addition to the 10 units of required courses, you'll need 6 units of electives. And you can choose from the electives you see listed here to make up those 6 units. And so we have electives that are in communicating real-world evidence, which also includes a medical writer professional development piece, which students find very beneficial. We offer citations and reference methods for medical writing. And then we also have a clinical trials course, documents and drug development, that can be taken as an elective. And also the health economics and outcomes research is available as an elective. The program costs are broken down for you here. Know that you are not required to pay the entire cost of the program up front. And so you'll see here that the approximate cost of the program, which does not include the prerequisites, this is just the cost of the courses, the required and elective courses, is $42.65. But the way the payment works is that as you register for each course, you pay for that course individually, which works out nicely as a payment plan rather than having to pay the entire cost of the program up front. So the prerequisite courses, remember, those are recommended and not required. So you may decide that there are 2 or 3 prerequisites that you are interested in and that you would like to take, and then you might find that there's 1 or 2 that you are that you already have expertise in that area. But if you take 7.5 units of the prerequisites that are recommended, the cost of those is $19.70. The cost of the required courses, the 10 units, is $25.80. And then depending on which electives you choose, so you will need to complete 6 units of electives. Depending on which electives you select, can cost between $13.40 and $16.85. The capstone, I'll talk about the capstone options in a few minutes. The capstone is not required to earn the certificate, so you can earn the certificate just by completing the required courses and elective units. But we have 4 different capstone options that are a really great experience for people who are looking to get some real hands-on work in a specific track of medical writing. And you in these capstone experiences, you have the opportunity to work very closely with the instructor. And so it's a great way to get feedback on your work. And after the capstone, you have something that you can put on your resume, and you'll have what's the right word I'm looking for? I don't know what it is.
Specialty, maybe?
Thank you, Donna. Not only is Donna one of our esteemed faculty, she also can read my mind and helps me finish my sentences when I forget what I'm talking about. She's a woman of many skills. Yes, so the capstone allows you to really hone in on a specialty that is of interest to you. There is an application fee for the program, and that is $50. And then there's also a certificate fee, which is $125. So that broken down there is the cost of the program. And many folks are able to finish the program in 9 to 12 months. You'll see the little asterisk here that's subject to instructor availability. Every so often, we're not able to offer a course as often as we would like, just due to instructor availability. But we aim to offer all of the courses in the program at least once a year, and most of them are offered twice a year, so that you have the opportunity to move through the program. Okay, so then the optional capstone experiences that we offer are here. They are priced at $13.95, and that is in addition to the cost of the other courses. We have a capstone in journal article and publication development, one in medication education materials, regulatory writing, and scientific grants. Donna, while I have you here, would you like to talk a little bit about your capstone, and just maybe share a little bit more about what that opportunity is like?
Sure. Hi, everyone. I'm Donna Simcoe. So I worked in publications for a long time. I worked in industry for almost 20 years at big pharma and also at smaller companies. And I started my own company about 11 years ago. So I'm a medical publication consultant, and I work with smaller companies, pharma and biotech companies, to help them with publishing their clinical trial data. And so in this capstone, it's a 10-week program that I get to work one-on-one with any of you who, if you might be interested in developing and writing your own manuscript. So you may have your own data through your institution, or could maybe do a review article, and would like to work with somebody one-on-one through all the different sections of developing a manuscript and hopefully getting it submitted and maybe getting it published. And also part of this course is also about publication management and strategy, and what we develop when we're working in a pharmaceutical or biotech or a medical device or diagnostic company, and thinking about clinical human trial publications kind of long term. So thank you, Jessica. Okay, you might be on mute, Jessica.
Donna, what would I do without you?
I'm so happy to work with you.
Thank you. I was saying to myself, that I saw that there was some chats that came through. So I think this is a good time to kind of pause and take a look at that just to see what questions people have. Let's see. I understand that prerequisites are optional. Is a bachelor's or master's in a related field a prerequisite to enroll in the program? Generally, yes. So this program is designed for folks who have an advanced degree in like biomedical advanced degree, but there are other areas of focus that have also been successful, and so that could be folks with degrees like in what was I thinking? Like public health. Jen and Donna, do you mind jumping in and telling me like who, other folks that might be a good fit for this program?
Maybe somebody who's moving from something like journalism or communications in other areas, because the writing is different and a little bit different in the focus, and the skills and the techniques are a little bit different in writing, for the types of documents that you see across the spectrum of medical writing. Other fields, I would say that those would set you up best for success. How about you, Donna? What do you think?
I was thinking maybe someone too who has a strong background, in science and has published quite a bit, might really have a lot of publications that they've already developed, but want to learn about different types of writing and specialize in maybe in a different area. I think this program gives a really great breadth of that, especially with the courses that you teach, Jennifer. So maybe we can head back to that slide in a couple minutes and Jen can talk about the courses she teaches too.
Yes, that would be great. Let's see, the chats are rolling in, so I'm trying to keep up. Let's see. How is the need to take recommended prerequisites determined? You are all very welcome to reach out to me directly, and I am happy to talk with you about your background and what would make you a good fit for the program and which prerequisites would be most beneficial for you. All right, another question. Is the program part of full-time within that 9 to 12 month window? Is the program part or full-time? Gotcha. Thank you. Thanks, Katie. It is dependent on how much time you are able to put towards the program. So to complete it within 9 to 12 months, that would be taking 1 to 2 classes. I think it's 2 classes a quarter. And it's usually about, let's see, 6 units a quarter, 6 to 9 units a quarter. So 6 units, that's 60 credit hours. I don't know if that helps, but that is the amount of time that you would need to be able to dedicate over the quarter to that coursework.
I would say relative to a traditional degree program, if you're thinking of, or I would say towards a degree program, I would consider it part-time. It's not going to be your typical full-time course load for sure.
Thanks, Jen. All right, I'm looking through the chat and I see a few of you are sharing your background. You are all welcome to reach out to me after this session, and I can give you some advisement about your background and if it's a good fit. And I can also link you with faculty who specialize in maybe what your area of focus, so you can really find out what you can get from this program. I see a question from Mohammed. Do we have to finish the certification in 12 months? No, you don't. So the university allows up to 5 years. So you can finish it in as quickly as 9 to 12 months, but you have up to 5 years or 21 quarters to complete the requirements. You are welcome. I'd like to, Jen, if it's okay with you, I'm just going to flip back to the slide that shows the required courses. Maybe you can talk a little bit about the intro and applied course. Thank you.
So the intro and applied courses, as Jessica mentioned, are a series that sort of form the foundation. I teach both of those. We recently revamped these. Actually, they're brand new, these courses. So it's a great time to be taking them. I look forward to having you in them. But they definitely build one on the other. So we're going to be pretty strict with having to take the intro course before the applied course. And so the intro course is really an introduction to the spectrum of medical writing, and obviously what it is, where you could expect to find jobs, what environments and contexts that is, what documents you might work on, and for what purposes and what audiences in each particular type of medical writing. So really a baseline introduction to across the field. And then in the applied course, just as the name would imply, we're going to talk about how to apply writing skills specifically within this realm of medical writing. And I've really tried to incorporate as much practice as is practical in this online setting. So I try and the assignments that I have they're necessarily in a particular area, but the skills that we're practicing with those assignments really can be translated to various different fields or types of medical writing. So, obviously, if we're practicing citations or referencing sources within the context of a journal article, that is going to apply to the background in a regulatory document or in a grant. So hoping to make that clear throughout the applied course, but that's the goal, is to give you practice in applying the basic skills. And I'm happy to, I actually have to leave this session in just a little bit early, in about 5 minutes or so, but I'm going to put my email in the chat, and I'm happy to answer any questions about those two courses and how they run and what the components are, what's involved. So reach out anytime.
Jen, maybe you could tell a little bit more about your background too.
Sure. I am an epidemiologist by training, and worked directly as an independent investigator in cancer epidemiology. Lymphoma was the field that I studied, but really loved helping other investigators communicate their results, and really through the whole life cycle of research, right? From coming up with coming up with the idea was the part I didn't like. So that's just too open-ended for me. It was too many opportunities. But once they have the good idea, and particularly working with clinicians who see patients and really have a front row seat to the problems that really need the research, they come up with the idea, and then, how do we write to get funding to study this idea through, if it's a clinical trial, the regulatory documents involved in that, and then how to publish the results and communicate them to a variety of audiences in an easy to understand way, in a clear way. So I switched into medical writing. I worked for a long time in cancer research, on, some regulatory documents, publications and grants. I've worked in academics the entire time, which is a little bit of a unique environment compared to some of the other fields, other employers. And now I work in cardiovascular research and advanced heart failure. So that's what I do, more so on the publication side now. There's something else I wanted to tell you, and I can't remember what it was. Did you ask me something else, or was it just background?
Yeah, just background.
Okay.
But,
That's what it was. I saw the question about Gen AI. I do address this a little bit in the applied course, for sure. And I imagine, Donna, I don't know if you're going to cover it in the capstone, but I imagine that yes, you will, because it's really I'm seeing a lot of development in the regulatory world with some standardized and template documents and some really good practical applications of Gen AI. So, Donna, do you cover it?
I don't really talk about it too much, but I ask anybody who is writing their manuscript that they're really writing their manuscript and not using AI, so that you really get that practice. And that's really what this part of this capstone is really understanding what someone goes through in order to develop their own manuscript or work with an author team, and that iterative process of understanding and writing and thinking about it and thinking about the structure. And so that's why I would prefer if people did not use AI when it comes to developing their manuscript. But maybe I could chat just a little bit about the program, if you wouldn't mind, Jessica and Jen. So I was lucky enough to be part of the advisory board before they started this program a number of years ago. And I also had taught a little bit of the applied medical writing and editing course until Jen kindly took over that and the introduction. And I think really what this program brings, which I think is really pretty unique. So it comes from, UC San Diego, so very prestigious organization or university. You also have the faculty on here who we really enjoy working with one another. We're on a number of committees in other parts of professional organizations associated with this field. We really believe, in the teaching of it, and we talk quite a bit. And we have, each of us have, decades, I think, of experience in lots of areas. And you also have not only a breadth of the different types of medical writing that you would be exposed to, but you also are being exposed to folks who work in different aspects. So some of us are employees at big pharmaceutical companies, some work at smaller biotech companies, some are consultants or freelance, and so you have people also at academic universities. So it's a really great program, I think, from that perspective. So I don't know if Jen or Jessica, you wanted to add anything else there?
This is Yeshi. I've also joined. My apologies for joining late.
Oh, welcome, Yeshi.
Hello, Yeshi.
Hi.
Yeshi, we were just talking about the different courses and introducing ourselves. So
Sure.
would you like to go ahead?
Yeah. Yeshi Mikias. Medical writing. I've been in medical writing for 20 years. Started off in publications medical writing, but I do regulatory writing. It's about almost half and half of my journey has been in either. So I teach the two classes. One is not listed in this curriculum, but it's the documents across development and clinical development. That is also offered, and I ask that people take that as a prerequisite to the other class I teach, which is the regulatory writing capstone. And in the capstone, what we do is we take the clinical study report, which is basically the document that everybody will write somewhere along the journey. And it has a guidance as well. We'll take a CSR and develop a full CSR from scratch. I give you the tables and figures, just like as if in a company. You take that and we go in detail on how to develop that with the lectures. So the lectures go through every step of the way of what is what and why and how. And so the purpose is to apply that to any clinical study report that you're going to be faced with, whatever therapeutic area. So there's a thought process to get you there. So by the end of the class, though, you'll have finished. There's mentoring. I do have scheduled. I'm probably one of the few here that I do have a face-to-face, sessions that we go walk through this. By the end of the class is to get you to apply. So we'll by the end of the class, you update your CVs, submit to at least 1 or 2 jobs. So that's the goal. So to Donna's point, the uniqueness of this program is there's a lot of mentorship, and we come from a lot of experience. The others probably, I don't know about other programs, but we developed this so that individuals are we give you FaceTime or whatever is needed to get you, because employment is the goal of it, is to get you there. So any
Yes, for the
questions?
other course that you mentioned, just so that
Mhm.
people know what you're talking about with what it's actually called. I think it's a prerequisite, correct? The primer?
Correct.
So I think it's
Correct.
on
No,
that
no, well,
slide,
no,
Jessica.
no. So actually, I just inherited, no, this is the one
Oh, it's
I'm
a
talking
different
about.
one?
This is the documents in drug development, writing protocols, reports, summaries,
Okay.
submissions. That I made a prerequisite because there was so much information in the CSR. I took
Mhm.
some of the elements there to get people to prime them and get them in the thought process of writing. So here you're introduced to all the documents. It's a good, I think it's a good high level understanding of many documents in clinical development, while in the CSR, we just go and focus on the CSR development. And then, of course, there's the primer, which I also inherited. So that one was, I'm going to start teaching it in summer. So since I don't have time to update it, the lectures are from the previous lecture. So that's really not mine right now, but I'm going to make it mine in fall. Right. Yeah. This is the primer one, is also understanding of clinical trials. It's a primer inside, because some people who come into the program don't have industry experience whatsoever. So if you have that, you don't need to take this. It helps you understand what drug development is all about in the first place.
Thank you, Yeshi. And just to recap, make sure that I got it right. Yeshi will be teaching this clinical trials and regulatory writing primer, which is one of the recommended prerequisites for the program. And then she also teaches the elective, which comes from the clinical trials program, Documents in Drug Development. And this is an elective in the medical writing program. But if you're interested in the regulatory writing capstone, then this course, this elective, is one of the electives that you should select because it serves as a prerequisite, gets you ready for that regulatory writing capstone. Did I say all that correctly?
That's correct. Thank you, Jessica, for summarizing.
Thank you. Thank you for taking over classes as needed. We appreciate you.
Happy to answer any questions. I know there are a number of people online.
I am going to move ahead just a little bit. Okay, yes, I just wanted to make sure that we covered all the content that I wanted to make sure to share with you all. I would love to open it up for even more questions. So you are welcome to come off mute and ask a question. You're also welcome to put it into the chat if you have questions.
Hi, Heather Rossi. I was just wondering, is there anything to the application process other than the application fee and your information and things of that nature?
Yeah, so the application requires that you submit either your CV or resume or transcripts. It can just be one of those things. It doesn't have to be all three. But it just gives me a good sense of where you're coming from. And then I can help determine if you're a good fit for the program. Besides that, there's also, I can't remember exactly how it's worded, but it's basically a statement of purpose. And that also helps me really understand, what your background is and what you're looking for in the program to make sure that that your goals are aligned with what we can offer you in the program.
Awesome. Could you also speak a little bit to, what are the benefits of doing the full certificate as opposed to, it sounds like you can also maybe a la carte take just some of the coursework?
Yeah, the benefit I see to completing the entire certificate is that it's a more robust experience. So you really get, rather than just getting sort of like tidbits of, you really get a more well-rounded approach to the field of medical writing and get a feel for if there's an area of specialization that you're really interested in. The most of the courses are available as standalone courses, and so you can, if you're interested, you can start the coursework and then decide later if you want to complete the certificate. You don't have to make that decision up front. But I think people find that doing the whole certificate, the benefit is, one, you can include it, on your resume as I completed this certificate. And you also get, I think you get more breadth of knowledge about the field.
If I may add, so the certificate, you'll need to go through all the classes to get to the capstone. If you're focused on one of the capstone, you'll need to go through all the classes or the certificate, whatever the certificate. Yeah.
And I could also add to that, if you wouldn't mind, that by taking all of the courses, you really get to see other options and other types of writing that you may not be exposed to before, especially if you're working in a company and you're sort of siloed in one area of writing. So you never know what you might like, and so you get exposed to that. And also, if you do complete the certificate and then you can put that on your resume, it really shows those of us who might be hiring writers that you're really very serious about this and really want to learn and want to understand and kind of understand the full breadth of the medical writing in general. And also too, maybe working at smaller companies, you might be tasked with doing some kind of writing that you had never really done before, so this might help you to prepare for that as well.
Thanks,
Jessica,
ladies.
there are a number, sorry, and I didn't mean to interrupt. There are a number of questions in the chat. I can take a couple.
Yeah, that would be
You
great.
can answer.
Thanks, Ashi.
Yeah, so maybe you can take the first one and then I can go in order. So if I apply this fall and I am accepted, can I choose to start course in spring? That's a
Yeah,
question for you.
We accept applications on a rolling basis. So there, if you are interested in starting in the fall, you can apply anytime up until, I think fall quarter doesn't begin until late September. So you have up until then to apply if you wanted to start in the fall, or you can wait and start in the spring. But there's no deadline for applications. You can apply whenever you would like. And then the Introduction to Medical Writing, the first course, is offered twice a year in the fall and spring. So you have two start points there.
There's a question, is this program good for MDs with no experience in medical writing? Sure. Yes, definitely. I had an MD who took it in fall last year, and he's a statistician. Actually, what he wanted to do was get into statistics. And I'm like, why do you want medical writing? He says, I want to understand what the end product goes into. So he did that and he really enjoyed it and it got him his job. Yep. So he's employed. Yep.
I also worked with one student. She was a medical doctor and worked and wanted to publish some of the clinical data, patient data, hospital data, and worked with their internal hospital authors. And she contacted me after the course that I got published. And so here she's got her own publication and lead author, and puts it on her resume.
Yeah, so that's one question. And then the other one was, what types of projects will be included in the program to help us build our resume and practice before working in the real world?
I provided a couple of answer as far as the intro and applied courses are concerned. So if you guys want to talk about it from your courses.
I think I've explained what happens in the capstone, so maybe that I don't want to spend time too much to reiterate that that is a full project. Jennifer or Donna, do you want to add anything?
I should clarify that the 9, I don't want to scare anybody with the 9 written assignments. That isn't like 9 papers or 9 CSRs or anything like that. It's chunks of documents that will have a focus on applying different learning objectives. So, and an opportunity to get feedback. So I don't want to scare anybody.
And then I talked about hopefully if you can develop your own manuscript and get it submitted, and then you have your own publication under your belt, which is great.
Jessica,
Another,
there's a couple. Go ahead.
I was going to say another question I saw was for international students. Do you need transcripts to be submitted or just a copy? I should have said that earlier. I'm sorry. You don't have to submit official transcripts for the application. They can be unofficial transcripts. They can just be copies. They don't have to be official.
Then there's another one that asks, can we take them out of order? Take the designing TLS before the intro.
You can. If you have some experience in the field, then it's probably fine to take things out of order. If you are brand new to medical writing, I recommend taking the intro course before taking anything else just to get yourself sort of settled into to the world of medical writing.
Who teaches the medical education? CME in fall?
That is Ann Jacobson. And I don't believe she's on the call with us today.
So about the question, do you track the success of your graduates? If so, what have you seen? I do. I do contact all my students. I think by now, I think I'm reaching, I can't remember now, 65 or 70 students. I link with them on LinkedIn, and that's how I track them. And about 60% are in medical writing. The highest one right now, my first class, he's a director. We're getting there. He's a director now. Now you ask me why 60%. The others intentionally, some of them intentionally don't want to go into it. So it's not that it was not a successful rate. It's just that they don't. That's not what they want to pursue. After the class, they realized that's not what they want to do. Majority of them. My fall class, 4 students, 2 of them are hired, 2 of them are waiting. So I do track. And I asked them, I mean, how has it helped you in your application and all that? I give text for your CV. I ask you, put this text into your CV. You need to have this text. So I do all that. I revise CVs. We talk about CVs. We talk about interview strategies. We talk about, yeah. So it's to get you there.
Also going to mention,
I don't know about you, Donna. So go ahead.
Oh, sure. I was just going to say that I also ask the students that after the course to please keep me updated if they do get their article published. And then I think, Jessica, too, UCSD has highlighted a couple of students, right, who and talked about their journey through this program.
Yeah, if you, let's see, visit our website, which I'm sure many of you already have, but you'll see some of the information that Donna was talking about. There's a link to our blog that includes some information about the field of medical writing. There is a link to a student testimonial, a student that came through the program. And there's also we have a LinkedIn group that you're also welcome to look into and join. So there's lots of ways to connect with us and also learn about the program and about previous students and their experiences. I see a question here from Sophie. I've had 2 years of experience in medical writing at a small company. How can I gain more from this program, or is it more for new graduates? Donna or Yeshi, do you have any thoughts
Yeah,
about
can I
that?
ask her what kind of medical writing? Publications, regulatory, whereabouts are you? Because if you're already focused, you know, can you email me offline and we can have a chat? I just want to understand, if you have 2 years, I would expect that you know it quite a bit. So, yeah, let's chat offline. If I may say something also, it's not to discourage anybody, but just to let you know what the reality there is. So the competition, you know, used to be many years ago that you can do it with a bachelor's in science. It's gone, progressed into master's in science and now PhDs. So your competitions are already advanced science students or science background. So it's you know, some people try to get into it without quite understanding it, and then once they get in, they realize, wow, this is not quite, you know, I'm trying to get you into the reality. So in regulatory writing, especially with a minimum of a master's and PhD is what you're looking at in some kind of a science area. Or I can also see, you know, nursing is fine. You know, nursing with a bachelor's, that's fine. But science area, but advanced. If you're pure science area, it would have to be a more advanced degree.
Do you find the same is true, Donna, in publications?
I'd say so. What I think about when I'm wanting to work with a writer is really experience, and this helps to get that experience. That's a lot of the question I think we all receive is, especially if folks are maybe trying to make a career shift or get out of the lab. And how do they get this experience? We're really providing that, really kind of hands-on, that when you do go and talk to someone, maybe in an interview, you already have a good background in whatever type of writing it might be, and so yeah, I would say so.
I see Cynthia's hand up.
Yes.
Hi, Cynthia.
Hi, Yeshi. So
Nice
what's the
seeing you.
rationale for that? Is it to give you credibility or for just understanding the medical
Yes.
content? Or why do you think a master's or PhD is
Good
best?
question. Good question. From an employer perspective, you have so if they have 2 CVs versus you know somebody with a PhD in science versus somebody with a bachelor's in science, they want the higher one. I mean, it's just the nature of there's so many PhDs now getting in. I mean, 20 years ago, there weren't that many. So a master's would have got you the best, you know, it was good. That's number one. Then the second one is credibility, because you're sitting at the table, you're coordinating all this with all these already PhDs. You know, you have an MD, you have a statistician who's a master's or an PhD. All these people, and you're sitting at the table also analyzing the data and making arguments about the data, and you know, sort of if somebody says it in a correct way, you're like, I don't think so, but can we like discuss? So that credibility sitting at the table versus, you know, somebody with the humanities won't be able to do that, sitting at the table and having those kind of conversations.
Great. It's kind of that critical thinking that if you
Yeah.
have that strong background, you can have the conversation and understand what they're discussing.
In saying that though, I you know, I'll give you an example. My mentor, she was an English major, but she started medical writing in the 70s. And so by the time she retired in the 2008, I mean, she was the medical writer in the company, right? So it's not in the past, because of experience, they built up quite a bit of experience, the people who are around for a long time. I hope that helps, Cynthia.
That helps a lot. Thanks.
Yeah. I mean, but I've seen people with an undergraduate, but a professional undergraduate, and ends with a professional, like nursing is a professional undergraduate. I have a number of medical writers who've done very well.
Right.
Right, well, we have just a few minutes left. Are there any other questions that you all have? You're welcome to unmute yourself and ask, or put them in the chat. Mohammed, you're welcome. We said thanks for all the information and answering our questions. You got it. That's what we're here for.
I've left my email in the chat if anybody has some more questions that they want to ask.
Thank you, Yeshi. All right, well, thank you, all of you, for spending some time with us this afternoon. I'll go ahead and wrap up, and this session will be posted on our website in the coming days. And so if you know anyone who would like this information, you can send them to our website. Thanks, everybody.